Now to the racial disparity in the number of Alzheimer's and dementia cases in this country and some of the possible reasons behind it. According to the Alzheimer's Association, Black Americans are twice as likely as their white counterparts to experience brain changes. For those over the age of 65, about 14% of Black people have Alzheimer's, compared to 10% of white people. The disparity is believed to be even more because many African Americans are not correctly diagnosed.
We know that many Black Americans are fearful and distrustful of a healthcare system that has committed medical atrocities against them.
The Alzheimer's Association expects by 2060, dementia cases in the Black community will increase fourfold. I spoke with a Maple Heights woman whose mother, father, and now husband have been diagnosed with dementia. She's determined to break the stigma, encourage people to speak up, and hopefully help families like hers get ahead of Alzheimer's.
There's been ups and downs. There's been joy. There's been sadness.
That's how Rosetta Moore describes her journey dealing with dementia, which took both her parents' lives.
There's been disappointments, anger.
If that wasn't enough, her husband Booker, a Korean War veteran,
I have to look and say, my husband is still in there. I just don't know where.
has been living with Alzheimer's for more than 20 years.
That's my heart. That's my heart.
Rosetta is Booker's primary caregiver.
Right here. This is my baby. I love her to death.
The Moore story, unfortunately, is not unique among African American families.
This disease is serious, and it's killing our people.
With Black Americans twice as likely to have Alzheimer's, there's a renewed push to raise awareness and break down barriers to care in that community.
It's going to be great if we can get ahead of Alzheimer's disease before it starts.
I spoke with Stephanie Monroe with the Alzheimer's Clinical Trials Consortium, and she tells me in order for that to happen, more people of color need to be comfortable talking about their brain health, especially with their doctor.
You've got to make patients feel that they can be their strongest and their best advocate and ask questions and not be ashamed.
Monroe says those patients diagnosed with dementia, especially in the Black community, need to ask if they can be a part of clinical trials.
We also know, though, if we don't get African Americans participating in research, that these drugs are going to be based on data from white European people that may not work for us.
We need to participate, and we don't need to participate because you're going to get paid some money.
Rosetta hopes by sharing her struggles, she can prevent other families from experiencing similar heartache.
So I still continue to go in the African American community to share how we need to communicate with our health care providers, how we need to communicate with each other.
She's dedicated to the cause because she believes dementia is more dangerous than cancer, which her husband has beat twice.
They can treat cancer and it can go into remission. This you cannot treat. His brain is dying every day, and I can't replace it.
Despite taking so many emotional hits over the years, Rosetta continues to find hope and reasons to smile.
It may not be a cure for him, but those that come behind him, there's a cure for it. And that's my hope. I can smile on that.
Well, like many Alzheimer's patients, Booker Moore can experience wild swings in his emotions, and that is what we saw during our interview.
It's okay.
After his diagnosis, Booker and Rosetta adopted Bandit. Now, over the years, the pup has alerted Rosetta that her husband wandered away. Thankfully, he was later found near I-480. But also, the time they've spent together has helped calm Booker during those emotional moments.
Give him a hug.
Come on over here then. This is my little buddy.
In the short amount of time that Bandit's been on his lap, I can see the change in him.
Makes a difference.
Yeah. It made a huge difference, and that just shows you also the power of pups, right? What they can do. And I said it was a testament to Rosetta and the work that she's doing with her husband, the fact that he's lived with it for 20 years, and she's known a lot of people that get diagnosed and unfortunately pass a short time later. So she's doing great work in her home and in the community.
Right, and this is something so many families can relate to, but it's good that they're really getting that message out there that we need to be mindful about our brain health and be comfortable with our doctors to talk about it.
You do. You have to have those conversations because if you can get it early, there are drugs that can help delay some of the the symptoms.